Hello, I am Dr. Bishash. I am a doctor of this clinic. May I confirm your name and age, please?
Yes, I'm Leonardo DiCaprio, 70 years of age.
Okay, Mr. How can I address you?
Well, you can call me Leonardo.
Okay, I have got a letter from your GP saying that you have lost a few kg weights over the last few months.
Yes,
Also, you have some problem with your walking and balancing. Is it right?
yes, doctor, it's right.
So I am going to take detailed history and all the information during your discussion will remain confidential. So is that okay for you?
Yes, doctor, completely okay.
So, Mr. Leonardo, can you please tell me in your own words what is happening with you?
Well, doctor, I have been quite well since the last 3 months, but for the last 3 months, I have noticed that I have been steadily losing weight. Okay, previously I was around 68 kgs, but last weight, which I measured around 10 days back, I was 61 kgs, so I lost around 7 kgs of weight. And at the same time, doctor, um, I had been, although I'm an aged person, but I have been quite fit, okay, physical. But sometime for the last some 2 months or 3 months, I think, I have been feeling some problem in keeping my balance, okay. So whenever I go out for a walk, I think that there is some problem in the balance, and that it looks that I have been drunk. People sometimes say that there is some movement. It seems that I have been drunk. So that was another issue, and that is another issue. And so I am a bit worried. And just 1 week back, I think that it was 1 week back. I just felt that I had some weakness in my right hand. It also was a bit worrying for me, and I think that the muscles of my hand, it's just fading away. It's not that much healthy again. I think it's getting thinner and thinner. It's a recent development in the last 6 7 days, I think. So all of these things are just causing me trouble.
I'm sorry to hear that. And you said that you lost weight. Was it totally unintentional?
It was totally unintentional, doctor.
How about your appetite?
Appetite, well, I think I have lost some appetite, I think. Okay.
Do you feel any nausea, vomiting?
No.
Any changes in your food habit?
No.
How about your bowel habit?
Quite all right, I think, doctor.
Okay. And in the meantime, that you said that you have some problem with your balance. So,
Yeah.
can you tell me that what do you mean by problem in your balance actually?
Well, doctor, there have been some problem actually, that I think there is some shakiness of my hands. Okay. And also whenever I start walking, okay, find it difficult to walk in a straight line. I feel that I just move to and fro, okay, just side by side, and it looks a very ugly walking. Okay, doctor. So that's it, I think.
Did it start suddenly or gradually?
I think it's it's a bit gradual, doctor. At the beginning, I just felt a bit uneasy, but people couldn't notice it that much. But nowadays, people are noticing it very sharply.
Okay. And you said for it last 2 or 3 months. Can you remember that? Did you get any injury to your head before the onset?
No, doctor.
Okay. And is it present every time and every day, or just sometimes comes and goes?
Well, at the beginning, it was not that much severe. It just came and go. Okay, but as the days are progressing, I feel that it's getting more and more frequent now. It's almost every day present, and it's whenever I move, I think most of the time I feel this problem nowadays.
And have you ever fell down or got an injury?
No, doctor.
Okay. And have you noticed anything that makes it better?
No, doctor. I haven't noticed that anything like that. Okay.
Anything make it worse?
Just this type of walking
Yes.
makes it worse.
And
This is just walking makes it worse. And another thing, doctor, actually, I have to tell you that I think that at times, I usually I'm a fan of alcohol. I'm sorry to say. At times, when I drink a bit more alcohol, I think this also gets worse. This movement issues.
okay, I can understand. And how severe is this condition? Can you do your own works or your essential works?
It's getting difficult, doctor. But because when I want to grip an object or something, I think that my hands just go past those objects, and there is some shakiness of my hands.
Have you noticed any changes in your vision?
I haven't noticed that much.
Okay. Do you have any headache?
No,
Any loss of consciousness?
no, not loss of consciousness, but at times I feel dizzy.
What do you mean by dizzy?
I just feel some abnormal weakness or something like that. But whenever I sometimes when I stand up from sitting position, it's a recent development, doctor.
Okay. And do you see blackening of vision during the time?
No, doctor.
Any rash anywhere in your body?
No,
Any hot or cold preferences?
no,
Any lumps or bumps?
no.
Any cough?
Yes, doctor. It's another issue. I think for the last 2 to 3 years, I think I have been facing some problems with my cough. At the beginning, it was dry, but for the last 1 year, I think I have been producing some phlegm. And the frightening thing is that for the 6 months or so, I have been experiencing that there is some blood mixed with it at times with the cough. Okay, or there have been 2 episodes of frank bleeding from my. There was frank red blood coming out. There were 2 episodes like that in the last 6 months.
Yeah, I am sorry to hear that. Do you have any shortness of breath?
No, I haven't noticed.
Any racing or pacing of your heart?
No.
Any chest pain?
Sometimes I feel chest pain, doctor.
Okay, and where do you feel the pain?
I think it's just sometimes I cannot just describe it accurately. I think sometimes it just discomfort on the right side.
Okay. And do you have any raised temperature at night or excessive sweating at night?
No raised temperature, doctor. I haven't noticed that.
Okay, I cannot hear you properly. And do you?
I cannot. I couldn't notice
Okay. And how about your
any raised
water work?
temperature. It's quite good, doctor.
Okay. And you said that your weakness on right hand for a few days. Is it
Yeah,
improving or is it deteriorating?
I think it's deteriorating, doctor. It just
And
began 1 week back. At the beginning, I didn't see that there was my muscle were fading away, but now I think even the muscles,
do you?
okay,
Yes. And do you have
I
any
think it's
pain?
fading away. What?
Any pain?
Uh, Not that much pain, doctor.
Any
But I have some
change?
problem whenever. Okay,
Yes.
okay.
Any change in sensation?
No, doctor, I just couldn't notice that much. Might be. Well,
And you
there might be some problem.
and you noticed any other abnormality
Where, doctor?
in your hand?
No, doctor. I think at times I find it a bit difficult to grip something. Okay.
Okay, I can understand. So, do you have any other past medical condition that you would like to share with me?
No, doctor. I don't know of any actually, any such past. But I had some high blood pressure, and I have been taking some medication for that, and it's under control now.
Can you show me your medication list?
Yes, it's Ramipil 5 mg and calcium channel blocker, amlodipine 5.
Any recent changes in the dose?
No,
Do you take any over-the-counter medication?
no,
Any herbal products?
no,
Do you have any allergy to any medication?
no, no.
Okay. And is your blood pressure under control?
Yes, yes, I told you that it's complete under control.
Okay, that's fine. And now, any of your family member have this type of condition or any condition that runs your family?
I don't know of any.
Any history of cancer in your family?
Well, actually, my aunt had breast cancer, I think. Yes.
I'm sorry to hear that. May I ask you a few personal questions?
Of course.
You said that you drink alcohol. Can you tell me that how uh, many amount?
I think it's
What is it?
250 pints per day. Okay. And at times, even I have some binge drinking. At that time, actually, I live a secluded life, doctor. I live alone. So sometimes I drink more. At weekends, I sometimes have around 7 to 8 pints with my friends.
I'm sorry to hear that. And this drinking also related to your condition. So I would recommend you stop drinking. And about your mood issue, I can refer you to the mood doctor so they can help you in this regard.
Okay.
And if you need, I can also refer you to this drinking cessation clinic. They can also help you.
Okay.
And, do you smoke cigarette?
I used to, but I have given up long ago.
How many sticks you
I,
per day for
I,
how
I
long?
gave it up about 10 years back, but before that I had one pack here for around 10 years, I think.
I can understand. And may I know that what do you do for living?
Now I am a retired person, doctor. Previously I was a school teacher, but now I'm retired. No, there is no one with me.
Yeah, I can and I can understand. Do you think that you need any social support or any economic support?
Well, it would be better because I live alone. I actually don't
You
need
will
economic
receive
support,
any.
but I would be better. It would be better for me if there were any help with my daily issues, daily activities, because I'm totally alone.
I will contact the social care department, and I think they will be able to help you. And do you
Okay.
drive?
Yeah. No, 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 doctor. I don't drive.
And may I know that where do you live? Is it a house or apartment?
I live in an apartment, doctor.
Do you need to use stairs?
Yes, it's the third floor, so I have to use stairs.
For that, we may need some relocation because of your condition. Okay.
Okay, doctor. Okay, but you feel better.
Do you want to add anything at this point?
Well, doctor, what's causing my symptoms? I'm a bit worried.
Actually, I need to examine you. Then I could give you the best explanation. As you said that you have some changes in your calf, you have produced flame and also pain on your right hand. Along with this, you have some problem with your balance. And this brings, I am afraid to tell you that this brings the possibility of cancer in the lung. But we need to do some investigation urgently. And after that, we can tell you exactly what is happening with you.
Okay, doctor. But am I going to die now? Lung cancer, such a dangerous issue.
I can understand your why you are afraid of it, but let us allow us time, and we are going to do this investigative test as soon as possible. And after that results come, we can talk with you the details about what is the diagnosis and what would be the next management plan. And before that, I cannot tell you exactly about your. I cannot give the answer of your question exactly.
Okay, doctor.
Time up.
Okay,
Do you have anything
okay.
question?
No, doctor. Well, so what do you think it's the cause here?
Okay, for this gentleman, my differentials are this is most likely a case of uh, paraneoplastic syndrome due to carcinoma of the lung, most likely small cell carcinoma. My other differential is this is a case of uh, cerebral dysfunction due to alcohol intoxication.
Okay. Okay. And what investigation would you like to do?
For this gentleman, I will go for the routine blood test, complete blood count to see anemia and white blood cell counts level, then inflammatory markers, ESR and CRP. And after that, liver function test, his renal function test, urine for routine investigations, random blood sugar level. And also after I will go for the peripheral blood film, and also I'll go for the chest X-ray to see any mass lesion, then CT scan of the chest, and after that I will go for the CT scan of brain.
Okay. And can you please tell me of one or two specific antibodies that are associated with paraneoplastic syndrome?
I cannot remember much, but some anti-Hu antibody.
Anti-who specific, I think. Anti-who. Okay. Okay. And okay. Well, actually, that was very well done. But I think that's a crossing question have been completed. But I would like to say something that there might be, it's actually a subacute case. Okay. 2 to 3 months history. Am I right?
Yes.
Okay. So in case of 2 to 3 months, actually, there could have been a bit more detailing. Like, was there any previous episodes of such type of trouble? This could have been important. And again, previously any eye issues previously, because multiple sclerosis can be a possibility here. Okay, cerebral dysfunction, and if any eye problem present or not. Okay, then you told about alcohol. That's very all right. But did you ask about his dietary habits? That was important. Vitamin B12. Okay.
Yes.
The vitamin B12 level was important here. And also, since vitamin B12 is important, although he's aged, but any gland problems in himself or in his family running, that would have been important. Okay, it would also have been important because some autoimmune profiling may have been done. Then you ask about job. It's good. Sometimes some toxin exposure can also be culpable for it. So any lead poisoning about where he stays, what about the pipes of his water pipe? Is it a poor old house or not? Okay, any lead exposure or not? That could have been asked. Now, another very important question I think it would have been asked is that whether of its any sexual exposure. Okay, HIV can sometimes cause progressive multifocal leukoencephalopathy with bizarre representation. Okay, so I think
Syphilis.
sexual, yeah,
Syphilis.
syphilis, yes, neurosyphilis, HIV. So this would have been a very important point. Again, you missed blood transfusion. Creutzfeldt-Jakob disease, variable Creutzfeldt-Jakob disease. It can also present with this type of subacute presentation at times. Okay. Yeah. So I think these points would have been asked well. Okay. Otherwise, it was quite clear cut when you actually asked about TAF, and it came out that actually it's a paraneoplastic syndrome. But I think these other issues could have been asked. And again, you asked about tuberculosis. That's all right, but you could have been more precise about infective endocarditis also. At times, infective endocarditis can also be a cause of this infective cause. Okay, but all right. Otherwise, I think it was a very good performance. Okay.
Okay.
And do you want to add anything else?
I thought first I thought it may be a presentation for subdural hematoma. So
Yeah.
I think asking about his memory problem, mood problem,
Yeah, memory problem would be
would necessary, but I forgot.
Yeah. Actually, in any case of neurology, any head trauma, any headache, any neck pain, any problem in neck movement, any raised temperature, any rashes, okay, any sudden development, any problem with his consciousness, any fits or any seizures, any focal point weakness. These have to be commonly asked, I think. No, these are the very common questions, I think. Weight loss, all these things, I think. So these have to be asked in any all questions, all sections, I think. Okay.
Yes.
So that's all I think. Otherwise, it's been quite good. Okay.